Cherries occupy a unique position in gout management, being one of the few foods with robust clinical trial evidence supporting specific therapeutic claims. This is exceptional in nutrition science, where most recommendations rely on epidemiological associations rather than interventional studies. The research on cherries and gout represents some of the strongest evidence for a food as medicine approach. The primary bioactive compounds in cherries are anthocyanins, pigments responsible for their deep red color. These polyphenolic compounds have potent antioxidant and anti-inflammatory properties. Anthocyanins inhibit inflammatory pathways including cyclooxygenase enzymes, similar to how nonsteroidal anti-inflammatory drugs work, but through natural mechanisms and without the associated side effects. Clinical studies have documented that cherry consumption can lower serum uric acid levels by measurable amounts. In controlled trials, participants consuming cherry products showed reductions in urate concentrations of 5 to 15%, depending on the dose and duration. While this may seem modest, even small reductions in uric acid can significantly decrease the likelihood of crystal formation and subsequent attacks. The most compelling evidence comes from a large case crossover study published in a major arthritis journal, which found that cherry intake was associated with a 35% lower risk of gout attacks. The effect was dose-dependent, with greater consumption conferring stronger protection. Combining cherry intake with allopurinol, a common gout medication, produced even greater risk reduction, suggesting complementary mechanisms. Both sweet and tart cherry varieties contain therapeutic compounds, though tart cherries, particularly Montmorency cherries, have higher anthocyanin concentrations. The more intense the red color, generally the higher the anthocyanin content. Fresh cherries, frozen cherries, and pure cherry juice all retain beneficial compounds, though processing can affect concentrations. The mechanisms by which cherries reduce gout attacks extend beyond uric acid lowering. Anthocyanins inhibit xanthine oxidase, the enzyme responsible for uric acid production from purines. This is the same mechanism targeted by allopurinol, though cherries provide a milder, food-based version of this effect. Additionally, cherries enhance renal excretion of uric acid, helping the body eliminate excess urate more efficiently. Anti-inflammatory effects of cherries operate through multiple pathways. Anthocyanins reduce the production of inflammatory cytokines, the chemical messengers that coordinate immune responses during gout attacks. By dampening these signals, cherries may reduce both the severity and duration of inflammatory episodes. Some research suggests cherries may also reduce the neutrophil infiltration into joints that characterizes acute gout. The antioxidant capacity of cherries helps neutralize reactive oxygen species generated during inflammation. Oxidative stress both triggers and amplifies inflammatory responses, creating a destructive cycle during gout attacks. By providing abundant antioxidants, cherries help break this cycle and protect joint tissues from damage. Practical consumption recommendations suggest that fresh cherries be eaten regularly during their season, with frozen cherries or pure cherry juice serving as year-round alternatives. A typical therapeutic dose cited in research is about 1.5 to 2 cups of fresh cherries daily, or an equivalent amount of juice without added sugars. This can be divided throughout the day for better absorption and sustained blood levels of active compounds. Cherry juice requires careful selection, as many commercial products contain added sugars and minimal actual cherry content. Pure tart cherry juice or cherry juice concentrate diluted in water provides therapeutic benefits without excess sugar. The natural tartness indicates high anthocyanin content, and unsweetened varieties should be prioritized. Timing of cherry consumption may influence effectiveness. Some evidence suggests consuming cherries at the onset of prodromal symptoms, the warning signs that precede full gout attacks, may abort or reduce the severity of the impending episode. Regular preventive consumption appears more effective than sporadic intake. Cherries contain minimal purines, making them safe even during acute attacks when many foods should be avoided. Their low purine content combined with therapeutic properties makes them one of the few foods actively recommended during symptomatic periods rather than merely permitted. The broader health benefits of cherries extend to cardiovascular protection, improved sleep through natural melatonin content, and exercise recovery support. For gout patients with multiple comorbidities, cherries provide systemic benefits beyond uric acid management.